Hi, I am Dr. JP Silvera from TaylorMade Health and Wellness, and I want to tell you about a patient who almost talked herself out of calling us. 2 days after her car accident, she was sitting at home, replaying the whole thing in her head. The crash had not looked that bad. The other car barely had a scratch. She had walked away from the scene feeling shaken but okay. So she did that thing a lot of us do, she waited. By the morning of day 2, she could not turn her head far enough to check her blind spot while driving. That was the moment she picked up the phone. Here is what I told her, and what I want you to understand if you or someone you know has been in a crash recently. The injury happens at impact, the pain shows up later. Those are two completely different events, and the gap between them is the part that catches people off guard. When your car gets hit, your head and neck whip forward and back faster than your muscles can react. We are talking about a fraction of a second. The soft tissues, the muscles, the ligaments, the tendons, the small joints along your cervical spine, they all absorb that force. But right after the crash, your body floods with adrenaline. Adrenaline is a remarkable thing. It dulls pain, it sharpens your focus, it gets you out of the car, over to the curb, through the conversation with the other driver, through the whole scene. You feel like you are handling it because in that moment you are. Then the adrenaline fades, usually within a few hours, and inflammation starts to build. Inflammation is your body's repair process, but it takes time to develop. By 24 to 72 hours after the crash, sometimes a little longer, that inflammation is in full effect. That is when the stiffness shows up. The headache at the base of your skull, the ache that runs from your neck into your shoulder blade, the feeling that your head weighs twice what it normally does. That timeline is not unusual. That is the normal biological sequence of a soft tissue injury. But because most people expect pain to show up immediately, they assume the delayed pain means something new went wrong, or they assume the delayed pain is not serious because they felt fine at first. Neither of those assumptions serves you. Now, here is the part about diagnosis that trips a lot of people up. You can go to the emergency room after a crash, they take x-rays, and the x-rays come back clean. The doctor tells you there are no fractures. You leave feeling like you got a clean bill of health. And then the pain hits on day 2, and you are confused because you were just cleared. X-rays image bone. Whiplash is a soft tissue injury. Those are two different structures, and a standard X-ray is not designed to show what is happening in your muscles and ligaments. Clean films from the ER are genuinely good news because they rule out fractures, and that matters, but they do not tell the whole story. You can have a real, clinically significant soft tissue injury and walk out of an ER with films showing nothing remarkable. This is exactly why getting a proper soft tissue evaluation after any crash, even one that looks minor from the outside, is worth doing. And the timing matters more than most people realize. Early evaluation gives you a clear baseline. We can assess your range of motion, identify which structures are involved, understand the severity, and build a treatment plan that meets you at the right point in your recovery. Whiplash that is addressed early tends to respond well. The inflammation is still in its acute phase, which means we have a real window to work with. We can reduce the severity of that inflammatory response, support the healing tissues, and start restoring mobility before compensatory patterns have a chance to set in. When someone waits weeks or months, the body has often already started adapting around the injury. Muscles that should be mobile have tightened up as a protective mechanism. Other structures start compensating. It is not impossible to treat at that stage, but it is a longer road. I also want to address something that keeps people from making that first call: the paperwork. If you were in an accident in Florida, your personal injury protection coverage, what most people call PIP, is designed to cover your medical evaluation and treatment regardless of who was at fault. You have 14 days from the date of the accident to seek evaluation and preserve that benefit. After 14 days, the coverage can be significantly reduced. This is a Florida-specific rule that most people do not know until after the window has already started closing. At TaylorMade Health and Wellness, we handle the PIP paperwork on our end. That is not something you need to figure out on your own or bring a stack of forms to your first appointment. We walk you through it.